Have you ever wondered what happens when a blood clot forms in one of your arteries? Well, that's exactly what arterial thrombosis is. In simple terms, arterial thrombosis is a blood clot that develops in an artery. Now you might be thinking, aren't blood clots supposed to help us? Well, you're right. Under normal circumstances, a clot forms to prevent excessive bleeding when you're injured. It's like your body's own little band-aid. But sometimes, these clots form when they're not needed, and that's when they can become a problem. Picture this. You're driving down a highway and suddenly, there's a roadblock. Traffic builds up and nothing can get through. That's essentially what happens in your body during arterial thrombosis. The blood clot acts as a roadblock, preventing blood from reaching vital organs. And just like a traffic jam, this can lead to serious problems. So what makes these clots form in the first place? Several factors can contribute to arterial thrombosis. These include high blood pressure, high cholesterol levels, diabetes, and smoking. Certain genetic conditions can also increase the risk. Now, how would someone know if they have arterial thrombosis? Symptoms can vary depending on the location of the clot. If it's in the heart, it can lead to chest pain or a heart attack. If it's in the brain, it can cause a stroke. But sometimes arterial thrombosis doesn't have any symptoms until it causes a major problem. That's why it's so important to manage risk factors and get regular checkups. Treatment for arterial thrombosis can also vary. Doctors might prescribe medications to break up the clot or prevent new ones from forming. In some cases, surgery might be necessary to remove the clot or bypass the blocked artery. So, to round up, arterial thrombosis is a blood clot in an artery. It can lead to serious health problems, depending on where the clot is located. Risk factors include high blood pressure, high cholesterol, diabetes, smoking, and certain genetic conditions. Symptoms can vary, and sometimes there are no symptoms until a major event like a heart attack or stroke occurs. Treatment can involve medications or surgery. Remember, knowledge is power. Understanding arterial thrombosis is the first step towards preventing it. So keep those arteries clear and keep that blood flowing smoothly.